He didn't die because he was sick. He died because a hospital reused a 5 Indian rupees syringe. A child in Uttar Pradesh 7 years old, frail, feverish was injected with a reused syringe in a government clinic to save cost. 3 weeks later, he was dead from hepatitis C. No one was fired. No one went to jail. The syringe cost less than a cup of chai, but that tiny, dirty plastic needle has now killed thousands across India. Thousands. And here's the truth that will make your blood boil. Hospitals across India are knowingly reusing disposable syringes. To cut costs. To save inventory. To pocket extra budget. They're playing Russian roulette with your blood. This isn't an isolated case. This is standard operating procedure in hundreds of clinics, especially where the poor go to die. And the health ministry knows. The state governments know. Hell, even the syringe manufacturers know. Because they've been screaming about this for over a decade, and no one has listened. Expanded narrative. Every year, India uses over 3 billion syringes. But only 1/3 are disposed of safely. The rest? Burned in fields. Dumped in rivers. Or worse, reused without sterilization. In 2023, over 19,000 new cases of HIV were traced back to reused syringes. In Rajasthan, one quack reused a single syringe on over 300 people. In Gujarat, a hospital reused 4 sets on cancer patients, many of whom later died of unrelated infections. Nothing happened. Why? Because a 5 Indian rupees syringe can become a 500 Indian rupees theft when reused 100 times. And because the lives being lost are invisible lives: poor villagers, migrant laborers, tribal communities, the elderly without advocates, children in rural schools. Who's to blame? Hospital administrators, who deliberately ignore safety to inflate profit margins. Politicians, who cover up systemic failure with token punishments. Health inspectors, who take bribes and pass unsafe clinics with a nod. You, the citizen, if you let this become just another headline. This is a pandemic. A human-made, budget-approved, blood-borne pandemic. And it's still going on. Right now, someone is being injected with a used syringe in some village clinic, their fate sealed by a 5 Indian rupees shortcut. Final words. So ask yourself. If you or your child ends up in one of these clinics, will the nurse change the syringe? Will the doctor check the seal? Will anyone stop the needle of death from entering your vein? Or will your name be added to the silent list of thousands killed not by disease, but by greed? This isn't a glitch. This isn't a scandal. This is a mass fucking murder operation disguised as cost-saving healthcare. Let me break it for you with surgical precision, but unlike your government doctors, I won't reuse this blade. Drop of blood, a tiny syringe. A colossal body count. 1 syringe. 5 rupees. That's it? That's what your life is worth in the eyes of India's public health machinery. A single-use syringe meant to be destroyed after one injection, reused 5, 10, even 30 times in the same clinic. No sterilization. No replacement. No fucking mercy. Diseases like hepatitis B, hepatitis C, and HIV are being pumped directly into your veins under the guise of treatment. The nurse knows. The doctor knows. The district officer knows. The entire chain of command knows. But they'll blame you when your liver starts rotting, when your skin yellows, when your child dies from a mystery fever that wasn't a fever at all, it was the result of a recycled death needle. Warning: cost-cutting or bioterrorism. What else do you call it when a healthcare system knowingly reuses infected medical tools on the living poor? In 2019, a fake doctor in Uttar Pradesh infected at least 58 people with HIV using the same syringe. In Madhya Pradesh, a woman was treated for a fever. She came out HIV positive. The clinic blamed her. In Jharkhand, villagers developed unexplained jaundice outbreaks traced back to a cost-saving syringe sharing scheme. This isn't rare. This isn't local. This is pan-India policy by silence. They won't print new syringes. They won't punish hospitals. They'll just bury the sick and shut up the survivors. Money bag the blood budget, pocketing lives for profits. Do you know how much money gets saved by reusing one syringe 30 times? Roughly 145 Indian rupees. Do that across 1,000 injections a day? That's 145,000 Indian rupees of blood money every month. Now multiply that across thousands of clinics in rural India. That's crores in stolen syringe savings directly pocketed by hospital directors, corrupt procurement officers, and pharma mafias. The poor are literally bleeding so that administrators can drive new cars and get kickbacks from contractors. And if a few of them get HIV? If a few babies go septic? If a few pregnant women die from internal infections? Collateral damage. Receipt they knew. And they let it happen. There have been 6 major WHO reports warning India about unsafe injection practices since 2002. 6. And yet, no national law mandates auto-disable syringes. No mass accountability scheme exists for syringe tracking. No doctor has ever served a full prison sentence for killing patients with reused equipment. They knew. They always knew. But a 5 Indian rupees problem doesn't matter when the dead don't vote. This isn't a glitch. This isn't a scandal. This is a mass fucking murder operation disguised as cost-saving healthcare. Let me break it for you with surgical precision, but unlike your government doctors, I won't reuse this blade. Drop of blood, a tiny syringe. A colossal body count. 1 syringe. 5 rupees. That's it? That's what your life is worth in the eyes of India's public health machinery. A single-use syringe meant to be destroyed after one injection reused 5, 10, even 30 times in the same clinic. No sterilization. No replacement. No fucking mercy. Diseases like hepatitis B, hepatitis C, and HIV are being pumped directly into your veins under the guise of treatment. The nurse knows. The doctor knows. The district officer knows. The entire chain of command knows. But they'll blame you when your liver starts rotting, when your skin yellows, when your child dies from a mystery fever that wasn't a fever at all, it was the result of a recycled death needle. Warning: cost-cutting or bioterrorism. What else do you call it when a healthcare system knowingly reuses infected medical tools on the living poor? In 2019, a fake doctor in Uttar Pradesh infected at least 58 people with HIV using the same syringe. In Madhya Pradesh, a woman was treated for a fever. She came out HIV positive. The clinic blamed her. In Jharkhand, villagers developed unexplained jaundice outbreaks traced back to a cost-saving syringe sharing scheme. This isn't rare. This isn't local. This is pan-India policy by silence. They won't print new syringes. They won't punish hospitals. They'll just bury the sick and shut up the survivors. Money bag the blood budget, pocketing lives for profits. Do you know how much money gets saved by reusing one syringe 30 times? Roughly 145 Indian rupees. Do that across 1,000 injections a day? That's 145,000 Indian rupees of blood money every month. Now multiply that across thousands of clinics in rural India. That's crores in stolen syringe savings directly pocketed by hospital directors, corrupt procurement officers, and pharma mafias. The poor are literally bleeding so that administrators can drive new cars and get kickbacks from contractors. And if a few of them get HIV? If a few babies go septic? If a few pregnant women die from internal infections? Collateral damage. Receipt they knew. And they let it happen. There have been 6 major WHO reports warning India about unsafe injection practices since 2002. 6. And yet, no national law mandates auto-disable syringes. No mass accountability scheme exists for syringe tracking. No doctor has ever served a full prison sentence for killing patients with reused equipment. They knew. They always knew. But a 5 Indian rupees problem doesn't matter when the dead don't vote. Balance scale: who will go to jail? No one. This isn't some accident in a dingy village. This is an industrial-scale operation of calculated medical homicide. Every reused syringe is a bullet. Every hospital that allows it is the trigger. Every government that looks away is the gunman. They have spreadsheets tracking savings. They have reports saying reduction in procurement achieved. They hold conferences on cost efficiency in rural immunization. What they don't track: infections caused, lives destroyed, families infected by one mother's tainted shot. They act like it's math. But it's mass murder dressed in PowerPoint. Microbe infection as policy. Let's get specific. Hepatitis C kills more than HIV in India. And the single greatest vector? Unsafe injections. Not sex. Not blood transfusions. Injections. They inject fever patients, diarrhea patients, pregnant women, infants. They use the same needle. Again. 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 In some clinics, they don't even pretend to clean it. Just swap out the patient and jab again. Your wife's antibiotics might be mixed with a stranger's HIV. And even if you survive the infection, you'll be left bankrupted by treatment, poisoned by shame, and discarded by a system that never once admitted fault. Soap sanitized by silence. The newspapers don't run these stories anymore. The editors say it's not new. The health ministers call it a one-off incident. The collectors say proper SOPs will be implemented henceforth. Meanwhile, villagers are digging graves. Families are drinking themselves into oblivion. Young girls are dying at 23 from cirrhosis they never earned. And the syringe contracts? Still awarded to the same suppliers. Still procured in bulk. Still funneled through ghost distributors and corrupt tenders. Ice cube chilling indifference. Ask yourself this. If the same thing happened in a luxury hospital in South Delhi. If someone injected Ambani's grandchild with a reused syringe, would heads roll? Would the doctor be arrested? Would the hospital be sealed? Would the country burn in outrage? Yes. But if it's a barefoot boy from Bunda? If it's a pregnant woman in rural Bihar? If it's a sanitation worker from Jharkhand? They die in silence. No candle march. No CBI inquiry. Not even a goddamn tweet. Fire how many more? How many more kids have to cry blood before you rage? How many more patients need to shriek in infected agony before a hospital is shut? How many more nurses need to say, "We're told to reuse," before you believe this is policy, not mistake? And how long before you realize that in this system, you're not a patient. You're inventory. You're disposable. You're experimental. You're a fucking number on a disease spreadsheet. They'll reuse the syringe. They'll reuse the bed. They'll reuse the lie. They'll reuse the excuse. But they'll never reuse the dead. Because once you're gone, you're no longer expensive. You're no longer dangerous. You're solved. They won't tell you the truth. They won't tell your family. They won't tell the press. Because when you die in a government hospital, the first thing they reach for isn't a doctor. It's a pen. Not to help. Not to mourn. But to lie. Drop of blood, you died from negligence. They wrote brought dead. The ECG flatlined. The monitor beeped into silence. The nurse panicked. The doctor blamed the nurse. The oxygen tank was empty. The defibrillator didn't work. The ICU light flickered while your chest stopped moving. And then came the paperwork. Brought dead. Not no oxygen. Not ventilator failure. Not medicines unavailable. Just 2 words, brought dead. It means, he was already dying when he got here, not our fault. It means, no inquiry necessary. It means, shut up, grieve quietly, take the body, and go. Receipt: they erase evidence faster than you can cry. Before your mother's body is even cold. The hospital register is updated. The treatment notes are misplaced. The medicine log is reconstructed. The cause of death is assigned something harmless: cardiac arrest, pulmonary edema, natural causes. You could have bled out from a surgical mistake. You could have been misdiagnosed, mistreated, or simply ignored. But none of it will survive on paper. Because if the paper says natural death, then no one needs to answer. No audit. No post-mortem. No lawsuits. No outrage. Just silence. And your body in a plastic bag. Warning: every doctor knows. Every admin officer plays along. This is not ignorance. This is protocol. The moment a patient dies in a questionable manner, the whispers begin. Fix the file. Don't mention the delay. Scratch out the BP reading. Say he was already septic. They manipulate timestamps. They adjust dosages. They falsify signatures of junior doctors who were never on shift. And if you ask questions, they'll say, "Sir, the file is confidential. Madam, please cooperate in your time of grief." There's no need to escalate things unnecessarily. Because if the file tells the truth, the entire system collapses. Your death is a risk to their career. That's the logic. Not your life. Not your pain. Your death is an inconvenience. If your wife dies in childbirth because they delayed the cesarean, the surgeon's record gets tainted. The nurse is suspended. The hospital gets questioned. So they rewrite the narrative. They make you the villain. She was too weak. She didn't come in time. She had a pre-existing condition. She was already bleeding. She refused treatment. She was already dead when we got her. And just like that, they're innocent. And you are erased. Syringe: real deaths. Fake reports. A national ritual. Every year, over 17,000 cases of hospital malpractice are reported in India. Do you know how many result in convictions? Less than 1%. And most of those are private hospitals. Because in a government hospital, truth doesn't survive paperwork. The internal inquiry is conducted by the same people who made the mistake. The death report is signed by a doctor who never saw the patient. The medical file disappears. The body is cremated before anyone asks questions. The families are poor, grieving, intimidated, and crushed. They don't have lawyers. They don't know RTI. They don't have media contacts. They just want to go home. So they take the body and shut up. And the next victim walks in hopeful, desperate, doomed. Brain: what this means for you. If you enter a government hospital, your life is conditional. If you die there, the story of how will be revised. Your parents might never know what really happened. Your children might never know who was responsible. Your pain will be erased, redacted, sanitized. This is not one hospital. This is every district hospital, every CHC, every overcrowded emergency ward where the doctor hasn't slept, the nurse is unpaid, the AC hasn't worked in 3 years, and the forms are worth more than the people. Skull and crossbones: you don't just die. You get rewritten. The scariest thing isn't that you might die in a hospital. It's that you'll die, and they'll say it was your fault. They'll say, "You waited too long. You came too late. You didn't follow instructions. You were already gone." And no one will question it. Because it's on the paper. Because it's signed. Because it looks official. Because in this country, paper is truth and the corpse cannot speak. And you'll just be another death that meant nothing. Another name in a ledger. Another fake entry in a ward register that won't be checked again. Because they won't learn from your death. They'll just add another lie to the next patient's file. Fire, they kill you twice, once in the bed, again in the paperwork. Do you understand what this is? This isn't death. This is erasure. When you die in a government hospital, they don't just let you rot. They rewrite your ending. They take your final moment, the panic, the pain, the silence, and replace it with a fucking stamp. Died of natural causes. Pre-existing condition. No signs of negligence. No oxygen. Not mentioned. Wrong medicine. Ignored. Doctor wasn't there. Covered. Vitals missed for hours. Deleted. They kill you. Then they kill the truth. And then they go back to lunch. Bomb. This is medical fraud on a genocidal scale. You think this is about one hospital? One case? One corrupt doctor? No. This is happening every single day across India. Rural clinics without crash carts. Tertiary care centers with no staff. Emergency wards where patients lie on the floor for 11 hours until they die. Doctors asleep during night shifts, then falsifying charts in the morning. Interns signing off on bodies they never even examined. And yet somehow, no one is ever at fault. Everyone is following protocol. The system did its best. No. It didn't. It just got good at covering its tracks. Whole accountability has left the building permanently. Where do you go to report this? To the hospital superintendent? He's the one who signs the lies. To the health department? They'll forward your complaint to the same hospital for internal review. To the court? Hope you've got 10 years, 5 Indian rupees locks, and the patience of a monk. And when nothing works, they'll gaslight you. Sir, maybe your mother's condition was too severe. Madam, don't tarnish the reputation of our hard-working staff. Let's not politicize this, please. No. Let's burn it down. Firecracker, imagine this happens to you. You walk into the emergency ward because your father is having chest pain. You beg for a doctor. The nurse tells you to wait for the duty doctor. You wait. He dies. You scream. They tell you he was brought dead. You know that's a lie. You watched him talk. You held his hand. He was alive. But the file says otherwise. And in this country, the file is God. Skull, welcome to the death factory. Government hospitals are not sanctuaries. They are paper-shredding death factories that mass-produce corpses with one hand and fiction with the other. They don't fear death. They fear blame. And they've built a bureaucratic firewall of lies to make sure you can't touch them. You can't even cry properly, they shove forms in your hand. You can't file a complaint, they say come after post-mortem. You can't even see your loved one, they've already sealed the body bag. No chance to investigate. No proof left. No record of pain. Just natural death. Even when it was murder. Man zombie, the system is already dead. You're just not buried yet. Don't be fooled. This isn't a health system. This is an industrial-scale meat grinder built to maintain the illusion of care while maximizing the denial of responsibility. It chews through doctors. It eats patients alive. It pays bureaucrats. And it silences grief. It doesn't save lives. It buries stories. And once you're dead, you'll be just another scribble in a notebook covered in bloodstains. Skull and crossbones. And do you know what the final insult is? They'll call it a case closed. No explanation. No justice. No punishment. No soul. They'll blame fate. They'll bury your memory. And by the time your family figures out what happened, they'll be too tired, too poor, too broken to fight. And that's exactly how they like it. They are counting on your silence. So scream louder. They are counting on your surrender. So rage harder. Because if this happens to you, your only weapon is this. You do not forgive. You do not forget. You do not shut up. Ever. They don't care if you're breathing. They care if you're blameless. Because a breathing patient is a liability. A dead patient? That's paperwork. And if they control the paperwork, they control the narrative. You didn't die because they gave the wrong injection. You died because your vitals were already unstable. You didn't die because they misread your ECG. You died because you arrived in critical condition. They don't even have to try hard because they know you won't question it. Because you're too devastated. Too poor. Too alone. And when you scream because your sister just died in front of you, they'll tell you to calm down. They'll tell you to maintain decorum. They'll shove a death certificate in your face and say sign here. They'll ask for your Aadhaar number, your ration card, your fingerprint, not for justice, but so they can wash their hands clean while your child's body is still warm. The hospital superintendent? Busy in his office. The surgeon? Off duty. The nurse who botched the 4? Transferred. The junior doctor who ignored the signs? Protected. The file that held the truth? Tampered. Erased. Or missing. Everyone disappears the moment death enters the room. But you don't get to disappear. You get to carry the guilt, the trauma, the injustice for life. And if you dare to complain? If you dare to knock on the door of the medical council, or the police, or the consumer court, they'll bury you under procedures. Forms. Technicalities. They'll delay your case until you're too exhausted to fight. And all the while, the same hospital will continue its slaughter. Another patient will take your place before the bed's even cold. Because in their eyes, you're not a human. You're not even a number. You're a problem to be neutralized. An error to be covered. A ghost to be erased before your story spreads. Because if the truth about one death escapes, others might start asking questions. And that cannot be allowed. This system survives on amnesia. On silence. On the assumption that poor people don't fight back. That grieving families don't read autopsy reports. That corpses can't file FIRs. But that's the fatal flaw, because once even one person wakes up from that grief fog and decides to burn the whole corrupt tree down, the system starts to crack. They're not scared of death. They deal with it daily. They're scared of exposure. Because death is cheap but accountability is expensive. And they've built their careers on dodging every rupee of it. So the next time you walk into a government hospital, understand this. If something goes wrong, if someone dies, if a mistake is made, the first response will not be to help. It will be to hide. And the final line in your file will not be your truth. It will be their lie, carved in ink, sealed in silence, and signed by the same hands that let you die.